Good morning. I'm Ted Burton, and this is our first Central Health Talks here on KAZI FM 88.7. For the next several months, we'll be talking about important healthcare issues that are important to you and your family. This morning, I have with me Shannon Jones. He is a Central Health Board member and former director of Austin Public Health. Shannon, thanks for being here.
Good morning. Thanks, Ted.
And also from Central Health, Tijerina. Michelle is Central Health's Director of Health Insurance Enrollment. Good morning, Michelle.
Good morning. Thank you for having me.
And today we want to talk about a very important time that's coming up here in the next few days. Starting on November 1st, it's time to enroll in health insurance for 2019. And so we want to talk about some of the most important information for you and your family around Obamacare. And this is your opportunity this time of year to enroll in health insurance for next year. So it's a critical time, and we're going to provide you with information about where to go, who to call to get you and your family enrolled in health coverage. So thank you guys for being here. But Shannon, I wanted to start it a little bit first and talk about Central Health and what Central Health is here in Travis County.
Okay, as I said, Ted, thanks for the opportunity to come back to what I call home as well. But Central Health is the local taxing authority in Travis County. It is the agency responsible for indigent care, those populations 200% of poverty or below, who need health insurance. And in Travis County, there are significant numbers of individuals who are due that. And what people always recognize Central Health as is that on my tax, those who have property tax, say on my tax form, I see this item that says Travis County Healthcare Authority. And so we're the agency that receives those funds. We're responsible for providing indigent health care. And we take that role seriously and responsibly. It is like other taxing authorities around the state, which are referred to as hospital districts. We refer ourselves as healthcare because we are a financing district, unlike we do not run the hospital, even though we are responsible for overseeing the operations of the hospital and funding it. So we're that agency that focuses in on healthcare for the indigent in this community.
And people may not realize that Central Health serves about 1 in 10 Travis County residents with low income. So Central Health is really focused on helping people get access to not just health care, but to quality health care. Is that right?
That's absolutely right. We assume sometimes that, well, if it's a governmental agency, it's not the best health care. But no, our agencies, the agencies we fund, the organizations we work with, provide quality health care, which makes a difference in terms of the quality of life of individuals in our community.
And you're a board of manager. How long have you been serving Central Health?
I've been there almost on my anniversary, almost a year now. It'll be a year in January. And I was appointed to a 4-year term in which I, along with my colleagues, are responsible for overseeing the policy, the governance, and operations of the agency.
So when we talk about providing access to health care for Travis County residents, can you expand a little bit on what kind of health care access we're providing? What kind of services do people get through Central Health?
Okay, we provide both primary care and specialty care. Primary care is basically your doctor services and those services where you go to see your routine doctor. We also provide specialty services. So if you have heart problems or cancer or some other things, we have experts that work with our agencies to address those things as part of your overall specialty care. We operate those through our collaboration with a variety of agencies. Most of you are familiar with the agency we call Community Care, which runs the neighborhood centers, the community centers in and around the city of Austin and Travis County. Locations of South Austin, the north location on Metric.
About 24 actually, all over the county.
Locations throughout the county. So we're very visible, we're very engaged, and we're very informed and involved in healthcare in this community.
And Central Health also has a relationship with the Dell Medical School at UT. Do you want to talk a little bit about that relationship and how that relationship is benefiting people in Travis County with low income?
Well, Dell Medical School, we work with in a collaboration to ensure that we have providers, if we look for future providers, provide some services as well. We partner with them as well as with Seton Healthcare to operate the hospital and to run the healthcare facilities, many of the healthcare facilities in our community. It is important in this community that we be up to date on the medical advances that are going forth. And so with the partnership with the medical school, with Seton, we're able to ensure that the care that are provided to our citizens are not, among the best here in not only this community, but also in the nation.
So Central Health can't do this alone. In fact, Central Health relies on a network of partners, healthcare providers, to provide access to health care. There's something called the Central Health Enterprise, which is really comprised of 3 affiliates. I want to talk a little bit about that because together, this is how we're providing access to health care for people with low income. So can you talk about the Central Health Enterprise and the Central Health Partners?
Yes, it's a unique opportunity, as I said, in other communities that you're familiar around the state, in Houston or in Dallas. Basically, those services are run and operated by the hospital district itself, not necessarily in a partnership as much. We have a unique situation here in Travis County, which is very creative, and it addresses the needs we have without having the heavy cost and burden to taxpayers. And so the Central Health, what we call Community Care Collaboratives, is a partnership with Seton, which provides health care to Travis County safety net population. We also work with Sendero Healthcare Plan. Sendero is the Central Health nonprofit insurance company for those who need health insurance, and as well as the wraparound services that are provided there. Central Health partners with about 200 hospital clinics, providers, and nonprofits, including Dell, Seton Healthcare Family, St. David's, to provide health care to people with low income. So we, in an enterprise or operation, are able to provide those services in a collaborative way with some of the experts and some of the in our community in the most efficient way.
So it sounds like really Central Health is the master planner funder working with this network of partners to provide care. It sounds complex, but it's really pretty simple. It takes partnerships and collaboration to deliver health care for 155,000 people a year in Travis County.
Absolutely. If you think about your hand, you have 5 fingers for the most part on them, and each of those work together to do things individually to make you function. The same thing with the collaborative. It has a variety of partners, and those partners work together to ensure the quality of health care in behavioral health, primary care, specialty care, or any other specific health care needs that our community has.
So you were director of Austin Public Health. I'm just curious, coming from that role and a long history of working in the healthcare arena in Travis County and joining the board of Central Health, what has been the biggest surprise to you, or maybe something that you weren't aware of, or something that you've learned over the last almost 12 months?
Well, that's a good question. It's been a joy and a pleasure to have served the city of Austin for almost 20 years. And in that role, I learned a lot about the prevention aspect of health, the things we can do to prevent it. My role now as a board of managers focuses in on treatment for the most part, even though there's a preventive aspect as well. And so probably the importance role that healthcare providers play in our community, making sure we have providers, make sure that they're timely, they're culturally appropriate, they're in the right locations, they understand the uniquenesses of the community, they have the resources that they need to be able to address those resources. Addressing the issues of disparities, which we also did in public health, is also part of what we're trying to do here in Central Health. So it's that collaborative role of prevention on one hand, and now the treatment or the therapeutic aspect of healthcare on the other hand, I think has helped me to be able to hopefully be a better manager for the community as a whole.
This is a good segue into talking about health coverage and health coverage programs, and I want to bring Michelle Tijerina into the conversation as well, but we're here today to talk specifically about the open enrollment period from November 1st to December 15th. But before we segue into that, there is a really important program that Central Health offers called the Medical Access Program, or MAP, and I think it's a pretty familiar name for people who either have used it or have family or friends who have used it. So Michelle or Shannon, can we talk a little bit about the MAP program and the medical access program, what it is and how it's different than private health insurance?
Sure, absolutely. So the Medical Access Program is a local program administered by Central Health. We provide primary care, prescriptions, specialty care, hospital care, and dental. It's for Travis County residents up to 200% of the federal poverty level. So for a family of one, that's about $24,000 a year. A family of four, that's up to $50,000 a year. MAP helps our residents get the health care they need. They can go to a clinic, they can get medicine, they can see a dentist, but MAP is not private health insurance. So that's why we're here today to talk about the open enrollment period for the health insurance marketplace.
So we're going to take a quick break, and when we come back, we're going to dive into what we often call Obamacare and how people in Travis County can take advantage of this upcoming period to make sure they have quality health coverage.
Support comes from Texas Performing Arts, presenting Jordi Savalier's reverent musical exploration of humanity and endurance, The Routes of Slavery, November 8th at Bass Concert Hall. Tickets at texasperformingarts.org.
At Austin Independent School District, we're getting our students ready for college, career, and life. From robotics and band to college classes and dual language, your future starts here. Learning is engaging and interactive, and classrooms aren't always defined by four walls. We're Austin School District, and we're proud of it. Come be a part of the AISD Proud family as we reinvent public education.
Support is provided by the Austin Area NAACP.
Hello, Austin. This is Nelson Leonard from the Austin NAACP. On December 1st, 2018, the NAACP will celebrate the 53rd annual DeWitt Oldham Freedom Farm Banquet. Our theme this year is the Fair Housing Act and its impact on Austin. Our keynote speaker is Professor Stacy Sutton. Her topic is Common Myths about Gentrification and the Facts that Prove We Need to Stop It. The program also includes musical presentation dedicated to our ancestors, the DeWitt Oldham Award, Caliber White Award, and the President's Award. The Austin NAACP is dedicated to improving the quality of life for African Americans and eradicating discrimination in all of its manifestations. For more information, please call 512-476-6230 or visit our website at naacpaustin.org. 512-476-6230, naacpaustin.org. Thank you very much.
Good morning, I'm Ted Burton. This is Central Health Talks here on KAZI FM 88.7. We're talking about health insurance and health coverage for you and your family this morning. And with me is Shannon Jones. He's a board member for Central Health and the former director of Austin Public Health. And my colleague, Michelle Tijerina, who is the director of health insurance enrollment for Central Health. Thank you guys for being here this morning. This is an important period that's coming up starting this Thursday, November 1st. It's time to enroll in health insurance for 2019. You only have 45 days. So, Michelle, I want to talk a little bit about why this time of year is so critical to people in Travis County who want to have health insurance next year.
Absolutely. So open enrollment is a dedicated time frame once a year when consumers can enroll in a health insurance plan offered through the health insurance marketplace. So for most people, this is the only time during the year that you can enroll in health coverage for 2019. So without a qualifying event, having a baby, getting married, or losing your employer coverage, this is the only time, 45 days out of the year, that you can enroll in health coverage for 2019.
So if somebody wakes up on December 16th and says, I need health insurance, it'll be too late.
Absolutely.
Yeah. And you mentioned qualifying events, and I want to explain what that means. There are some exceptions, but they're the extraordinary exceptions.
Sure. So if you have a qualifying event that's going to change your household size or income, such as, getting married, having a baby, you lose your job, you have a change in income, then you have 60 days from the day of that qualifying event to ask for a special enrollment period offered through the health insurance marketplace where you can enroll in coverage for that same year. But without a qualifying event, the open enrollment period is the only time during the year that they can enroll.
So there's two phone numbers that we want you to take note of during this program. One is 211, and we'll talk about that. To get health insurance, you really need to know one phone number, 211, to call to get help. And also, we want to offer you the chance to ask some questions. We have a couple of experts here today with us. So if you have any questions, you can call 512 836-2887, and we'll be happy to take your questions over the air. That's 836-2887. But Michelle, back to the health insurance marketplace. It has several names. People call it ACA, Obamacare. What do you refer to it as?
So I refer to it as the health insurance marketplace.
Okay.
And the health insurance marketplace is a place for people who don't have coverage offered through their employer, through Medicare, Medicaid, the Children's Health Insurance Program, or other sources. Now, the great thing is financial assistance is available. So if you don't have health insurance, the health insurance marketplace is a great place to get the coverage you deserve.
So in the past, in previous years, it was mandated you had to have health insurance or you could face penalties. Has that changed?
It has changed. So the individual mandate is still in place. However, there will not be a penalty assessed for 2019. So if you don't have coverage in 2019, you won't be penalized. However, I must say, health insurance is so important. It protects you from it protects you from medical costs. It covers preventative care. Your annual visits are free. You know, I've seen life-saving events where individuals have health insurance for the first time in their lives. They've gone to the doctor, they've been diagnosed, and were able to receive the life-saving care that saved their lives because they had the health insurance they deserved.
I was talking to a friend a few days ago and mentioned that the open enrollment period was coming up here this week, and they said, well, I thought Obamacare was dead. I thought that had been killed, essentially. Not the case. Obamacare is actually alive and well.
It's very much alive. The Affordable Care Act is still the law. Financial assistance is still available. And we have several plans. Locally, we have 31 plan options this year, offered by 4 different qualified health plans. So there's several options available. We have enrollment specialists throughout the county available to offer in-person assistance to our residents for free.
And I want to, Shannon, actually thank you and the Central Health Board of Managers, because while nationally the New York Times reported that funding for enrollment services and education and awareness initiatives has been cut 80%, here in Travis County, the Central Health Board of Managers has committed to continue to fund these types of efforts to get the word out, to let people know about health insurance.
Yes, we are committed to ensuring that the quality of health for our citizens are the best they can. And the best way to do that is ensure that they have access to health care. And the best way to have access to health care is to have insurance. And then the way to do that is to make sure people understand it, get enrolled, and involved. One of the things we have to realize, we live in a very political world, and we won't spend a lot of time talking about this now, but the current national administration is not one who's supportive of it. And so it's important for those of us who are at the local level, who see what's going on in the grounds every day, to deal with the realities of it. As Michelle was saying, one of the greatest feelings one has is to be able to go to the doctor or to get health care. And the way you do that is to ensure that people have access to those services. So as a board, we're committed to ensuring here in Travis County citizens have that access, and the importance that plays in terms of taking care of themselves and making sure they have options, not having to wait to an emergency. One of the things we see, particularly in communities of color particularly, is that because of costs and other factors, is we wait until the last minute and go to the emergency room. One, that's the most expensive care, and secondly, it's only episodic. They're only going to deal with what you're there for. So by taking the effort of having a physician, having health insurance to cover that physician, having the ability to go out and to select from providers, you're taking ownership of not only your own health, but that of your family as well. And we as a board are committed to ensuring that everyone has that opportunity here in Travis County.
Earlier, you talked about collaboration and partnerships, and that is really how Central Health is able to deliver access to health care here in Travis County for people with low income. And Michelle, I think collaboration and partnerships are also critical when it comes to letting people know about the open enrollment period that's coming out. And I know we work with partners as well to make that happen. Can you talk about that and our work with Foundation Communities?
Sure, absolutely. We partner with numerous groups locally and our local 211 center to ensure that our residents have access to in-person assistance. And Foundation Communities is one of our partners, and we've partnered with them for several years, and they have two of our largest locations here in Travis County, one up north off Airport and another down south off Stasny, and they're open 7 days a week. They have appointments available daytime, evening, and weekends. They take walk-in services. They've been able to help. They've been able to help over 5,000 people
Wow.
just during the 45-day period that we have to enroll.
That's amazing. I think we have a caller, and if you want to get your question in, you can call 512-836-2887. But let's talk to the caller.
Good morning. I was
Good
just
morning.
wondering, I came in on the last when she was talking about these places, one on Stasny and out north. But I was wondering about the clinic card. Does that still exist, and how would it help in health insurance?
I think you may be talking about the Medical Access Program, or MAP card. Is that what you're asking about?
Yes.
Yes, it does exist, and it is not the same as private health insurance, but it does exist. Michelle can talk more about that, but I want to give you a phone number to call if you need information about the MAP program or the MAP card, and that's 512-978-8130.
Well, what is these places that she was mentioning? What does they do that she said was open 7 days a week and on Stasny?
Sure, absolutely. So I was speaking about enrollment sites such as Foundation Communities who can help you enroll in a private health insurance plan offered through the health insurance marketplace. So we do have the medical access program where you can use your medical access card to go to clinics that are in the MAP network. But right now is the open enrollment period for the health insurance marketplace. And so we have enrollment groups across Travis County that you can go for free in-person assistance. They can review all of your health plan options, talk to you about financial assistance is available. Assistance is free. They'll walk you through all of your health options. If you're interested, they can help you pick a health plan that best meets your needs.
Okay.
And really, the easiest thing for you to do would be to call 211. So call 211 and tell them you're interested in enrolling in health coverage in 2019, and they'll take it from there. They'll set up an appointment for you to talk to an application counselor. It's a free service, and that way you can make sure you're getting the exact health coverage that fits your situation.
Thank you very much.
Thanks for calling. So we brought up 211. Michelle, can you talk a little bit about what happens when someone dials 211 and what the process is from there?
Sure. So when you call 211, press option 1, and you'll get our local 211 representatives. And they have, in partnership with Central Health, a community-wide scheduling system. So we have appointment templates for all of our enrollment groups here in Travis County that are part of our Enroll ATX coalition. And so if you call 211, they're able to give you all the options that are available, the different enrollment sites throughout Travis County. They can schedule an appointment for you. They can give you referrals. They can tell you who has walk-in services. Or if you're from another county, they can give you referrals in your area as well.
So this is Ted Burton with Central Health, and this is Central Health Talks, talking to Michelle Tijerina with Central Health, one of our eligibility experts here for Central Health, and one of our Board of Managers, Shannon Jones, who is former Director of Austin Public Health. Michelle, there are some changes from last year for the health insurance marketplace. Is that correct?
You know, there is, Ted, and one thing that I want to make sure that everyone is aware of is there are now short-term plans offered outside of the health insurance marketplace, and I want to make sure that our residents are informed and don't get confused with the plans that are offered through the health insurance marketplace. So these short-term plans have limited coverage, and they're not required to offer all the benefits that our qualified health plans offer through the health insurance marketplace.
So the network of doctors might be smaller, or the clinics might be different, correct?
Yes, or they may not pay for the same services such as maternity care or behavioral health services. And so now these short-term plans may very well meet someone's needs. I just want to make sure that our residents are informed. They're aware of all of their options. So please call 211, meet with an enrollment specialist to review all of your options.
And you may have insurance this year, 2018, that you got from the health insurance marketplace last year, but you can renew. But Central Health recommends that you call 211 and talk to an expert, because your situation may have changed, your financial situation may have changed, your medical situation or health situation may have changed. It's just good to take a look at your plan and make sure that your plan fits your needs and that you're really maximizing any of those tax credits that are available. Is that right, Michelle?
Absolutely. If you're already enrolled in a health plan offered through the marketplace, there is the option to auto renew. However, as you mentioned, we do recommend that you meet with an enrollment specialist. Rates have changed this year. There's new health plan options. Their situation may have changed, as you mentioned, and we just want to make sure that you're aware of all your options and that you're getting all of the financial assistance that you qualify for.
And Shannon, you mentioned that Sendero is that Central Health's nonprofit health HMO or health insurance plan, but it's not the only one that is on the marketplace.
No, actually, Sendero Health Plans is a Central Health's health maintenance organization who offers plans through the marketplace. As I mentioned earlier, we do have 31 health plan options this year offered by 4 qualified health plans. Sendero is definitely one of them. We also have Blue Cross Blue Shield this year, as well as Oscar and Superior that have products on the market.
People can go to healthcare.gov and look at the different plans that are available. I've done that myself, and it is a little confusing. I think, do you need to be a health insurance expert to pick out the right plan, or it can be so overwhelming?
Well, I think one of the challenges we have in our country is that the private marketplace can be complicated because a variety of partners are in play there. So as you've indicated, and Michelle both, it's important that people educate themselves about health insurance, because if you get the wrong one, then you can end up with a bad product. And so contacting 211, talking with them, having them to get you an appointment, set up to talk about what are your needs. Each individual's needs are different. And in a community like Austin and Travis County, where you have a complex, multifaceted community made up of a variety of different populations, it is important that you get the right brand, the right insurance, the right coverage that you need for you, your family, your significant others, or whomever, in order that you are covered appropriately. Because in our society, we want to make sure we have that so we don't waste our resources or not have adequate coverage.
And what are some of the things that you look for in a health insurance plan? I assume it's the providers, making sure your doctor is in the network. What are just some of the different things that you take into consideration, or a person should take into consideration?
Well, as Shannon said, every person's situation is unique. So when you go and review your health plan options, it's not just about the monthly premium. You need to look at, are your providers in network? What services do they cover? What percentage of services do they cover? If you know that you're going to physical therapy, how many days of physical therapy do they cover? If you're on different medications, what are their co-pays for their prescriptions? How many prescriptions are you taking? Do they cover the medicine that you're taking? So there's a bunch of different options. It's not just about the monthly premium. There's out-of-pocket cost. There's providers in network. And so that's why we ask you, go to an enrollment specialist. They can review all of your options. They can talk to you about your unique situation and help you pick the plan that best meets your needs.
And again, we want to emphasize this Thursday is the start of the open enrollment period. So this Thursday, the day after Halloween, after you've had your share of candy and trick-or-treaters, it's time to get serious about your health coverage for 2019. You'll have 45 days to enroll from November 1st to December 15th. And then that's it, right, Michelle? If they don't enroll in that period, with a few exceptions, they're not going to have health insurance.
You're absolutely right, Ted. You must enroll by December 15th in order to have health coverage for 2019. So please do not delay. Time is limited. We have 45 days.
So I'm Ted Burton with Central Health. This is Central Health Talks. My guest today, Shannon Jones, a board of manager with Central Health and the former director of Austin Public Health, and Michelle Tijerina. She's the Central Health Director of Health Insurance Enrollment. And we have a caller on the line.
Yes. Good morning.
Good morning.
And good morning, Shannon. It's good to hear your voice and know that you're still active in the health field.
Oh, he's very active in the health field still.
Yes, indeed. But my experience is that I called this particular company for this insurance, and my agent, we sit down and talk for him to find out things about me, to find out what kind of things did I need more than the other. You know what I'm saying?
Mm-hmm.
So I would suggest that, and I'm covered very good. I am so pleased with the coverage that I have.
That's
and
great.
The company. Mm-hmm. So I would suggest that they call in and make an appointment with one of the representatives of the company and sit down and talk with them, and then they will be able to suggest the better company for you. That's what and the best plan for you.
I think that's great advice.
Yeah, thanks so very much. I appreciate the shout out. That's why we're here. We're here to take callers like you and others who have expertise in terms of what it is to deal with insurance and to get suggestions on ideas. So we really encourage them to do exactly what you said. It's a call, get information in terms of what their particular needs are.
And we're just trying to make it really, really simple. You just have to remember one phone number, and that's 211. It's a free service.
That's right.
You call 211, and they will connect you with an application counselor and do just what you said. Sit down, look at your situation, and make sure you're picking the best plan for your situation.
Right, and they don't have to leave home a lot of the time.
You're right.
They will come to your home and talk with you, and sit down and talk with you, so you'll be very comfortable and be able to think a little bit better in your home. You know, you'd be surprised how people go out and they're not quite comfortable, but especially the elderly. So if they are in their home and they sit down and talk, I think that it will work so much better.
Well, I think that's great advice, and we appreciate you calling in and sharing some words of wisdom.
Yes, and thank you, and y'all have a blessed morning.
You too.
Thank you.
Thank you very much. So again, we heard from a caller, great advice, talk to somebody. It can be complicated if you try to do it by yourself.
You know, a lot of times we have individuals, and I saw this previously, and we know in our community, who are just afraid to talk with someone. And so the opportunity to be able to call 211, get an appointment, go in and talk with them about information. It relays a lot of fears, a lot of concerns. Out in the community, I hear a lot of time, it is just too complex. I don't understand. My mother has this, but my father needs that. Those kinds of things. And I think it's for our listeners, it is important for you to do, as the caller said, is to take the onus on yourself, make the call, find out. Michelle has clearly said many times, you have, 45 days. So the clock is ticking. Remember, this is something that has been sort of sped up this year because the National Administration is not necessarily supportive of this effort. So it's important for us to be successful to make this work, that we take the ownership on ourselves to get that appointment, go in and make sure that we take advantage of this opportunity, because it's not guaranteed it will continue unless people really utilize it.
The Central Health Board of Managers has committed to investing in education to make sure that people in Travis County know what resources are available when it comes to enrolling in health coverage. Local communities and local entities like Central Health have picked up the slack, so to speak, because there have been some barriers put in place that could prevent people from knowing about their health coverage options. For example, last year, Michelle, I believe, was the first year they cut the enrollment period in half, correct?
That is correct. In the past, we've had 3 months or more. First year, we had 6 months. They've extended the enrollment period in the past, and last year was the first time that we had only 45 days, and it's the same case this year. 45 days to enroll is a short period of time. It goes by really fast.
But I think one thing that tells you people really want health insurance is that in spite of, or despite some of these barriers, the number of people who enrolled last year was down just slightly from the year before. So despite having half the time to enroll, less money to get the word out about enrollment, people are still going to ACA, to the marketplace, to get health coverage.
You're absolutely right, Ted. And I must say, locally, we could not do this without the dedicated support of our Central Health Board of Managers. I've been with Central Health over 9 years, and the last 5 years I've had the privilege of working since the inception of the health insurance marketplace. And since year one, our Board of Managers wanted to ensure that our residents were aware of the benefits that were available to them and that they had free in-person access to health insurance enrollment. And, to date, our Central Health Board of Managers has, dedicated over $3 million in health insurance enrollment services and public awareness, and another $5 million in premium assistance. And
the funding is working because the uninsured rate in Travis County continues to go down.
That's absolutely right.
We do have a caller on the line. The number is 512-836-2887. Caller, are you there?
I'm here.
Good morning.
Good morning. I have a question about the Affordable Care Act.
Sure.
If an employer offers insurance to an individual, but his wife is not working, and so she cannot apply for the Affordable Care Act, can one deny or refuse the employer's insurance and get on the Affordable Care Act so it can cover him and his wife?
So there are some rules in the Affordable Care Act, and it's a little tricky around employer coverage. So you are never forced to purchase health insurance through your employer. However, there is something written in the Affordable Care Act where if you're offered affordable coverage through your employer, and that is if your employer offers you the lowest rate plan available to you as an individual that is less than 8.25% of your household income, then you have affordable coverage. And unfortunately, they describe that as affordable coverage for you, but then it disqualifies your dependents if they're offered dependent coverage through your employer from getting financial assistance through the marketplace. So you're not turned away from the health insurance marketplace. In your case, your wife would not be turned away, but if your employer offers dependent coverage and the coverage they offer you as an individual is affordable, then your wife would not be eligible to receive financial assistance through the marketplace. However, that's where Central Health comes into play. So we have community care health centers across Travis County, and no one will be turned away for health care or their inability to pay. You can be put on a sliding fee scale program based on your household income and family size, but you will never be turned away for your inability to pay. So there's no reason anyone in Travis County should go without health care.
And it sounds like the best thing for him to do would be to talk to his employer, but then call 211. And talk to an application counselor who can explain, because it is complicated, and we get that, and we want to try to make it as simple as possible. So would that be the best advice, Michelle?
Absolutely. Call 211, talk to an enrollment specialist. They will even call your employer with you to make sure that they get the information that your employer is offering, the different coverages. They will walk you through every step of the way. We're here to help you. You're not alone.
Thank you.
Thank you for calling. So I just want to go back, and for folks who've been with us for the whole hour, they may think that we're being slightly repetitive, but there are some really important things to remember about what's happening this week, and starting with the open enrollment period and how to get coverage. So, Michelle, again, would you please let our listeners know what they need to do this week? And it's important not to delay because life can get in the way. We don't want somebody waking up on December 16th wondering what happened to the open enrollment period.
Absolutely. So the 2019 open enrollment period of the health insurance marketplace begins this Thursday, November 1st, and runs through Saturday, December 15th of 2018. Now that's only 45 days. 45 days to enroll in health coverage for 2019. Now, for most people, this is the only time of the year that you can enroll, so time is limited. Thursday, November 1st through Saturday, December 15th. Do not delay.
And if you have health insurance and you enrolled last year during the open enrollment period, you can renew what you have, but Central Health recommends that you call 211, talk to an enrollment specialist just to make sure that the coverage plan and the healthcare company you're with is what is best for you and your situation. So even if you think you're set and everything is good, we still recommend that you take a few minutes to call 211 and meet with an enrollment counselor to find out if the health insurance plan you have fits your situation, and coverage options have changed and prices have changed, and you may want to make sure you're in the best plan.
Absolutely. Get informed. Be aware of all your options. Assistance is free, and we have enrollment sites across Travis County.
We're going to take a short break. We still have an opportunity to answer your questions if you want to call 512-836-2887. This is Central Health Talks. I'm Ted Burton. You're listening to KAZI FM 88.7.
If you are in need of business cards, banners, tickets, invoices, magnetic signs, carbonless forms, receipts, notary services, window or door lettering, flyers, plastic or wood signs, affordable delivery printing, your dial printing and sign service. For more info, Ray Knox at 512-707-7291. That's 512-707-7291.
Support provided by the Millennium. Looking for a fun place to have a party and a great time? The Millennium has the ultimate birthday party packages in Austin. Sit back and relax for 1 full hour. Your special party host will run the entire show. All you bring is the cake, kids, your guests, and they will take care of the rest. Millennium packages include roller skating, bowling, arcade, birthday party supplies, choice of hot dog combo or pizza, and soft drinks and ice cream. Are you ready to party? You can contact the Millennium at 512-472-6932 or myec.net.
It's some funk, R&B, old school, and even some jazz. Put it all together, and you've got Kurt Childers on Thursday afternoon at 1 p.m. Central Time.
Good morning. I'm Ted Burton. This is Central Health Talks on KAZI FM 88.7. We're talking about health insurance and health coverage for you and your family this morning. It's a really critical week. On Thursday, which is November 1st, the open enrollment period begins to get health coverage for 2019. We have a caller on the line. Caller, thanks for dialing in, and what's your question?
Hi, so it's a comment and a question. So on the 211, we refer, and from my office, I like the service, and we refer people to them, and I just wanted to put out there that it has options for different languages.
Thank you so much for bringing that up.
Yes, so when you call, you can dial, it'll ask for, if you dial this number, you can get Spanish, for this number, Vietnamese, and it has different languages. And then you can also, when you get an operator, you can ask for a specific language, so like Swahili or whatever. So it's available for all languages. The other thing that I wanted to say is that about that, or ask the question, is I'm not sure if y'all have gone through it yet to find out what are the prompts to actually get to an enrollment specialist, because it's a little difficult sometimes if you get someone on the phone that doesn't know how to go through prompts. So our office has gone so far, because we refer to the same people all the time, we've gone so far as to go into the system and figure out which prompts that person will have to get a specific service.
And may I ask where you work?
I work for the health department.
Oh, okay, great.
So, like I said, what we do is, we'll say when we get the person on the phone, we'll say you need to dial 1, dial 2, and then you'll get to the person. So I just wondered if y'all, I just wanted to ask if y'all could give out that information if it's available.
Sure, and you're absolutely right. When you call, you press option 1, and then it will walk you through prompts in English. So, we're lucky to have people such as yourselves. They do offer over 100 different languages, as you mentioned. We do have walk-in sites, so if someone is not comfortable calling 211, they can walk into Foundation Communities, and they have language services there as well. So they can go to 5900 Airport, or they can go to Stasny and Westgate, and they take walk-in services. I know some people are more comfortable in person and not having to call and go through prompt situations, but that is great advice, and we're lucky to have people such as yourselves that can help our clients as well.
And I just wanted to say one last thing is that I myself use Foundation Communities, and I have turned my mom and my stepdad onto them, and they use you. We've been using you for at least 6 years now, and it's a great service. It's free. I walk in. There's experts in there that are helping me, that have saved me, because my mom used to go to a lawyer that made her pay $50 a page for whatever her income tax was, and now she goes in there and it's completely free.
That's wonderful. That's
thank
wonderful.
Thank you for your services.
Thank you.
Thank you for calling. Appreciate that. Central Health also has a dedicated website where you can go to find information about enrolling in health coverage. You can find locations, as Michelle was just mentioning. So if you go to centralhealth.net, then /enroll ATX. You can find locations where you can walk in and get in-person assistance. And of course, we keep wanting to remind folks to call 211. That really is the easiest way to get information about health coverage for 2019. And Shannon, we've talked a lot today about health insurance and health coverage, which is such a critical piece of a person's health. But I wanted to take a couple of minutes to talk about some of the activities that Central Health is focused on to bring health care services to more parts of the county, specifically eastern Travis County. This is where people are moving because, frankly, as many of our listeners know, the cost of living in Austin is skyrocketing, and people are moving east to find more affordable housing. But unfortunately, with that move comes more barriers and more challenges to getting health care.
Yes, thanks very much. As part of Central Health mandate in terms of providing access to affordable health care, we also look at where people are living and where do they need the health care. And if you look at the history of the district as well as prior to the district, most of the health facilities in this county were located roughly within a mile of I-35. And what we realize is that over the last 20 years, for a variety of reasons, the populations have moved out. And primarily those who are recipients of the services we provide have moved east. And so under the leadership of Larry Wallace and the executive team there at Central Health, with the support of Mike Giesland, who is the new CEO, we've been able to focus in on the services in eastern Travis County, bringing them there. So we're looking at new facilities. We're looking at facilities in the Colony Park area, in the Austin's Colony area, in the Creedmoor area, in Del Valley, and in other parts of the eastern, what we call Eastern Crest crescent of Travis County, where populations have moved. Over the last 10 years, over 100,000 people have moved into this area. Many of those are people who have moved out from areas that are unaffordable. As part of our efforts to address those, we're also hosting a series of town hall or community forums under the leadership of the outreach team, which Ted, you and your team are doing great, to be able to get from the community, what is it that we need to do? Where do they need to be? What type of services? What is the cultural appropriateness for those services? And so we want to let the public know that we're engaged in those. So you will get notices either through your community organizations, your faith-based organizations, or other outreach efforts to let you know we're having these meetings, and we want you to come out and share with the Central Health team about what you'd like to see in services in those particular communities.
In fact, Shannon, we were out last night, Mike Giesland, myself, and my colleagues in Hornsby Bend. We met at the Catholic Church there with community members to hear from them about what type of services they want to see out there. And also, when we talk about placing clinics, we want to hear from the community, what's the best location? Because the folks that live there probably have a really good idea where things should be and what kind of services they need. So we had a great meeting last night with about 40 residents and got some really constructive and helpful feedback from the people that live there. So we have a few minutes left, so I want to encourage you, if you have a question, feel free to call us at 512-836-2887. I'm Ted Burton, and this is Central Health Talks on KAZI FM 88.7. We're talking about health insurance this morning, health insurance for 2019. If you or your family needs health insurance, this Thursday is a very important day. It's the beginning of open enrollment through the health insurance marketplace, which is the Affordable Care Act or Obamacare. And Michelle, you've done a great job this morning talking about all of the particulars that people need to know, dates and times and phone calls. But for anyone who may have joined us late, I wanted to recap really what's happening for the next 45 days and why it's so critical to our listeners' health.
Absolutely. Thank you, Ted. So it's the 2019 open enrollment period of the health insurance marketplace. As Ted mentioned, Thursday, November 1st, that's this Thursday, open enrollment begins, and it's only 45 days. So you must enroll by December 15th in order to have health coverage in 2019. Rates have changed. New plans are available. Your personal situation may have changed. So get informed. Be aware of all your options. We have enrollment specialists available 7 days a week, daytime, evening, and weekends, and they will meet with you and review all of your health plan options and help you pick the plan that best meets your needs.
That's great. I know I can procrastinate sometimes, and sometimes about important things, but I think the point is you really don't want to delay. You don't want to take any chances. Nothing is more important than your health. And health insurance is a critical part of making sure you can live a healthier life. Shannon?
Michelle, I had a question that people have asked me. So if I was on it last year, do I need to do anything different this year? Do I need to enroll, or does it continue? A lot of people have that question. Sure, absolutely.
You know, there is the option that auto-renews the health plan that you had last year, but it also auto-renews your tax credits. And so we recommend that everyone go in. As I mentioned, the rates have changed and plans have changed. People's situations have changed. So please call 211, meet with an enrollment specialist. You want to make sure that you're getting all of the tax credits, all the financial assistance available that you qualify for. So you can auto-enroll, but just get informed. Know all your options. Make sure you're in the health plan that best meets your needs.
Well, I want to thank Michelle. What a wealth of knowledge you are when it comes to the Affordable Care Act and helping our listeners get health coverage. Thank you, Shannon, for being here and sharing your knowledge and expertise. And thank you and the Board of Managers for the investment you've made in education and awareness to make sure people know about the open enrollment period. Again, call 211. Open enrollment period begins this Thursday, November 1st, and runs for 45 days. I'm Ted Burton, and you've been listening to Central Health Talks on KAZI FM 88.7.